Good morning, good afternoon, good evening. 안녕하세요, Fleet's right. I'm Pierre-Yves Berclaz. I'm the Senior Vice President, Head of Global Medical Affairs, Neurology and Immunology at Merck. This is the slide with my abstract. But before I go in my presentation, I'd like to make a very important comment. As you will see, we will describe Rebif interferon beta 1a during our presentation. I want to clarify that Rebif is approved to treat relapsing form of multiple sclerosis, to decrease the frequency of relapse and delay the occurrence of some of the physical disability that is common in people with MS. It's important that you know that due to lack of data, the benefit-risk profile of Rebif for use in patients with COVID-19 infections cannot be determined. To date, Merck's interferon beta 1a is not approved by any regulatory authorities for the treatment of COVID-19 or for use as an antiviral agent. I think this is important because we do not have the intention to share and spread any inappropriate claims and indication. What I would like to do in this presentation is outline this agenda. First, explain how the WHO, with its blueprint during the COVID-19 infection, identify Rebif, interferon beta 1a, as a potential therapeutic agent. Second, I will have a brief, high-level review of the physiology of interferon beta 1a. Then I will go and explain how this external collaboration with Merck was established and progressed. I will talk about the key decision points that we had to go through, elements that could have been hurdles, but we were able to go over. Also, I will talk about, in my opinion, what are the key success factors which led to that very amazing results, which is still ongoing, but still a great achievement, and then the potential next steps. The World Health Organization, WHO, has the R&D blueprint as a tool which is in fact a global strategy and preparedness plan that will allow rapid activation of research and development activities during epidemics. This was developed following the Ebola infections. When COVID pandemic started, that was a very important tool to develop actions against COVID-19. On the 11th of 12 February 2020, WHO gathered the world's best scientists to first assess the current level of knowledge about the new virus, also to agree on clinical research questions that needed to be answered urgently, and to find ways to work together to accelerate and fund priority research. That led to the establishment of some guidelines, including a collection of what would be the most appropriate targets in this pandemic. There was interferon beta 1a, which could be used as a potential therapy in the management of COVID-19 infection. In their blueprint and list of potential targets, WHO has multiple elements that are assigned. So interferon beta 1a, which is Rebif and also produced by other companies, was mentioned in terms of license indications, how it's being used, the dosing, some of the elements that have been researched and published for virus infections like coronaviruses, SARS, also what will be the dose that they suggest for COVID-19, and finally some other indications that could be developed with this target, such as ARDS, the acute respiratory distress syndrome for interferon beta 1a. Now I would like to go as an overview of the role of interferons as antiviral cytokines. So interferons are cytokines, small signaling molecules which are released by immune cells and affect other cells in the body where their receptors are expressed. There are several types of interferons, in fact 3 major families, type 1, type 2, type 3, and even within those families you have subtypes. So you have interferon alpha and interferon beta. Rebif is an interferon beta 1a, part of the type 1 interferon family. The viruses trigger rapid production of interferon, and as shown in this very schematic diagram, they can trigger multiple immune responses. One of them is interferon beta response, and then also have other immune response like Th2, Th17. When you think and focus on the interferon beta response, you have 2 major roles, simplified. One is an antiviral replication effect, and the other one is an immunoregulatory effect, which is also very important because you probably have heard about the cytokine storms that have been associated with COVID infections, and that's just a way for interferon to regulate the immune response and modulate them to avoid those cytokine storms. So basically, once you have the viral infection, interferon can act in two ways. One is antiviral, the other one as an immunomodulator, and that's important to know. I would like now to go over the chronology and the interaction that Merck has had with WHO and INSERM. We had on February the 3rd a first communication with the World Health Organization, who had questions about interferon beta 1a rebif, our experience and supply. Similarly, the INSERM, l'Institut National de Santé et de Recherche Médicale, reached out to us on March 8th with questions very similar to WHO. And I have to say that in a very short period of time, both the Solidarity trial from WHO and the Discovery trial from INSERM were launched. And I think this is an amazing result with the limited amount of time and the multiple collaborations across industry and organizations. Both Solidarity and Discovery trial are quite similar. They have 4 arms. Above standard of care, you have resmidivir, that we heard a lot about recently and very positive results, as well as in addition with lopinavir, ritonavir, and interferon beta 1a, rebif, and also with the addition of hydroxychloroquine. So those 5 arms are part of a Bayesian adaptive clinical trial design, which allows the enrichment of the most effective arm and best protect the patient's best interest. I'm very proud to say that Merck has donated 290,000 units of its interferon beta for the Solidarity trial of the World Health Organization. And this is in addition to the donation which were announced for the Discovery trials, with altogether count for more than 300,000 units of its interferon beta 1a rebif. And I think this is a great success for both to make sure that we can work in the same direction. To achieve these results, when you imagine the short period of time that was established by the time that the interaction was done and then the first patients was enrolled in this clinical trial, some very important decision points had to be managed. The first one was, of course, the communication with the sponsors. The appropriate CDA, LOA had to be established so data sharing and information sharing could be done in the right way. The second one internally for Merck was the creation of a task force, which was cross-functional and with the right expertise. That allowed us really to make quick, rapid decisions appropriately and also have a single point of contact with WHO and INSERM. The next step was also to fully evaluate, using external as well as internal data, the benefit risk assessment of using rebif as an antiviral agent. It was also important to understand the dosage in those clinical trials. The usage of rebif in multiple sclerosis is a chronic usage, while for COVID infection, you need to have an acute treatment, which was quite different. And then finally, when we talk about the safety benefits, the reporting of the safety is also important. And then with the great collaboration with WHO and INSERM, we're able to meet those requirements and also gather the information not only on efficacy, but also on safety. More importantly, I believe, the last point is the supply. Because our team, manufacturing and supply, was able to work at the global level rapidly. They were able to provide in regions where rebif was not approved and working with WHO to make sure that out of the 70 planned countries in the world as a global clinical trial, as well as in Europe with INSERM, the supply was maintained. One thing was also the supply for the clinical trials, but also to make sure that there will be no impact on the supply for the patient with multiple sclerosis. And I'm very proud to say that this is a very, very strong effort by this group that I want to highlight. I'd like to share with you now what I believe were the key elements for our success. The very first one is really a strong leadership support. The example from our CEO, Belén Garijo, has been critical. She was always supportive and helped us to make quick decisions. The second one is also in terms of the focus. All our effort was really focusing on helping the patients. It was a patient's first approach, and it was critical and great motivators for teams who have been working long hours in a very difficult environment, sometimes untested. And that leads to the third point, where we have a need to be cross-functional, to have coordination and collaborative approach. You cannot function in silo. You cannot function as one company. You cannot function as one country. To make sure that we prevent that, a very strong communication with the multiple stakeholders as well as internally was important. Imagine if we have a global clinical trial developed at the global level, but when you have my colleagues at the country level working with other HCPs and being asked questions and I cannot answer how this will help, it's going to be counterproductive. That's why it was very important to make sure that we could share the progress. We can have statements that could be explained and understood by the country level colleagues so they can really help the success of those clinical trials globally. It's also important that we do that in a transparent way and are responsive. You cannot wait. There is an urgency there that is very obvious. Any delays is translating to patient lives. So for us to share all we need as soon as possible was critical. I think the task force, as well as the interactions with INSERM, WHO, and other external groups, has shown that agility. It's an agility which is operational. We can get things done, but also mindset. We want things done. I think that was critical for us to be successful. Now, as for the next steps, we're all very interested to know as soon as possible the outcome of the Discovery and Solidarity clinical trial in terms of efficacy and safety, as you can imagine. Merck is also continuing to accelerate our research and discovery effort in antiviral, immunology, and other efforts. We will continue and reinforce the external private and public partnership, for example, with the Bill and Melinda Gates Foundations, with the Jenner Institute for Vaccinations and others. And then finally, it's important, as we're doing now, to continue to share our learnings internally and externally. We would like to do the same way as WHO has done and developed their R&D blueprints to develop tools that prepare us for the next crisis. And hopefully it will not come soon. Thank you very much.